OK, let's talk about truth, transparency, fear, media, politics and the pandemic. Because I got to say, with 12 million people locked down in this country, the rest of us curbed and threatened by increased restrictions and state border closures, we need to be pretty certain about what's going on and why. First up, there are about 350 people with COVID-19 in this country on this day, including about 100 in hotel quarantine. Of those, 2 are in critical care beds. 2. There are a total of about 60 people in hospital, but the bulk of them are in Queensland, where they put everyone who tests positive into hotel quarantine in hospital, even if they're asymptomatic. So what we know is that 2 people in this nation are seriously ill. No others are even on a ventilator, but 12 million people are locked down. Now, how and why do we get into this situation? Well, first and foremost, we end up with this sort of an overreaction because so many in authority peddle fear.
This is perhaps the scariest period that New South Wales is going through.
This Delta variant, the Delta variant of the COVID virus, is actually a gold medalist when it comes to jumping from one person to another. It is a long jumper.
We're neck and neck with this virus, and it's an absolute beast.
We still have many people dying around the world.
10,000 people are losing their lives around the world every single day, but we can't be complacent with this disease. We see the consequences of other jurisdictions who are really experiencing terrible, catastrophic situations around the world.
Catastrophic, yeah. The politicians and the media love to generate fear and hysteria. It's ever been thus, but particularly on this issue. Now, as you know, I challenged the South Australian Premier and Chief Medical Officer on these issues yesterday. Extraordinarily, they went close to locking down their state. The Premier actually said South Aussies should be relieved not to have gone into lockdown over 5 cases in one family who had all been in isolation anyway. Now, the Premier and his health officer refused to answer my pertinent questions. And I showed you all that yesterday, of course, and if you didn't see it, you can go to the Sky News website or follow me on Instagram and click through the link in the bio. Catch up on that later. But what astonishes me is that many people in the media here in Adelaide and around the country, they defend the politicians and the health officers refusing to level with the people. And they essentially argue that these questions should not even be asked. Have a listen to how I was introduced in an Adelaide radio interview this morning.
News conference given by the Premier and Chief Health Officer, broadcast by 5AA yesterday, drew a lot of reaction. And not so much for the decisions that they announced, but a lot of it revolved around the questioning by Sky News and Australian journalist Chris Kenny. Chris joins me now. Chris, you received criticism and praise in almost equal proportion.
Wow, just wow. Well, it's actually Graham Goodings, not Will Goodings you've seen there. Graham Goodings is Will Goodings' father, and he interviewed me on 5AA this morning. He's a long-time newsreader in Adelaide, filling in on 5AA. Just extraordinary there. He's talking about the big decision to have me on the program. I went on to discuss some of the crucial issues, of course, and the crucial facts, such as how most of our lockdowns in this country have been proven to be unnecessary, the facts that are so often ignored by those peddling hysteria. And listen to how he wrapped up the interview.
A lot of people who said that we shouldn't have put you to air, but I think, it is a democracy and there are various points of view, and I know I'll get criticism from allowing you on.
It's hard to believe that this is what Australia has become, isn't it? We've become fearful, compliant, incurious and subservient. The peddlers of fear have got the public frightened and timid, and much of the media too. I'll show you some detailed evidence of this later in the program, but let's start with the key questions that Stephen Marshall and Nicola Spurrier refused to answer yesterday. These questions are really crucial for all premiers and chief health officers around the country. What is the trigger point for locking down a state or closing a state border? That's a crucial one, as is the percentage of the population that needs to be vaccinated before lockdowns can be ruled out as an option. Also, now that the vulnerable are largely vaccinated, what is the real threat of COVID-19, given healthy young adults, let alone children, rarely get very ill from the disease? And therefore, shouldn't we be reassuring the public about our COVID-19 success rather than frightening them about a catastrophic situation that can no longer arise here because the vulnerable are largely vaccinated, not to mention almost a third of the entire adult population? Anyway, I'll keep asking those questions, but have a look at this today in Adelaide from Professor Spurrier. After refusing to address yesterday how mild the COVID-19 threat is to most people except the elderly, well, she jumped at a chance to ramp up the concerns again today.
The minor was quite unwell yesterday and he needed to have a medical assessment, so he went to the Royal Adelaide, but I'm pleased to say that he's now been transferred back to Tom's Court. So that's obviously a great relief for his family. But it does show how serious this infection can be, even in people who are relatively young and fit and healthy.
Look, no one wants to get crook, and we all know there are risks, but really you use a quick checkup, trip to the hospital to keep the panic levels up just in order to justify your own decisions? That's not reasonable and transparent leadership. That's scaremongering. By the way, 0 new infections today in South Australia. 0 infections. And they nearly locked down yesterday.